Bismillahirrahmanirrahim. So I welcome all of you, and we are going to start paper number 5. But before going into the detail, I would like to request you to watch my videos for at least 4 to 5 minutes, because if you are not doing that, I will turn off the download option. But I am not going to do that because I want to help you more and more. But just for run the video for 3 minutes out of 30 minutes that I make video usually. So if you play video for 4 to 5 minutes, it will help and encourage me to make more and more videos. So coming toward the topic, most of the girls have amenorrhea during lactation. Now the cause is, the answer to this question is D. It inhibits gonadotropin releasing hormone. That is, when the baby is sucking, there are the signals going to the hypothalamus to release this secretion. If this is not an option, then the answer is due to release of prolactin. But this is the actual answer. Reference is the Guyton. And coming next, the helper T cells. Now the helper T cells, the actual option is missing. That is, actually they release cytokines. The helper T cells or the T cells, they actually release cytokines. Now we are having the helper T cells and the cytotoxic T cells. The helper T cells, now this is the reference to that MCQ. The helper T cells, this is the T helper cells. They require antigen presenting cells equipped with MHC2. So the CD8 cells, they are the cytotoxic T cells, are the T killer cells. So they are having MHC1, and the CD4, they are having the MHC2. This is another MCQ. Whatever I am discussing, I am giving you extra points for MCQ. So I'm not making you bore on the explanation. The explanation of MCQ is actually the statement of other MCQs that are highly repeated. So the CD4 cells are CD4 cells are MHC2, and these are the helper T cell. The cytotoxic T cells are the CD8 positive. So over here you can see, initiate humoral immune response in cooperation with B lymphocytes in immunoglobulin production. So if that option is missing, that is the cytokine formation, then the next best option is immunoglobulin production. Now the memory cells are both, memory T cells are CD4 and CD8 positive. Not going into the detail of this discussion, we have to limit our discussion to the MCQ. So the correct answer over here is induce plasma cell to produce antibodies. So that is the right answer. Other than the nucleus DNA is present in, the answer to this question is, that is mitochondria. And there is another question regarding that, the mitochondria comes from the mother or from the father. The answer is the mother, M for mother. And there is another MCQ regarding mitochondria, that which of the organelle is capable of reproduction irrespective of the cell production. The answer is mitochondria, because it has its own DNA. So the organelle which is self-replicating is mitochondria. There is another MCQ that a patient, a microbiologist is looking into the cell during dividing phase. What will the microbiologist see? Now the answer to this is centrioles. Now the question is asking about the cell is in dividing phase, not the organelle is in dividing phase. And whenever the cell is in dividing phase, we can see the centrioles. We can see the centrioles. Coming next, the most powerful chemoattractant is the C5A. The C5A, that is the chemoattractant. Well, there is another MCQ that we are confusing with this. That is the most powerful chemoattractant that causes bronchospasm. That is leukotriene. That is then leukotriene before. That is the answer, then leukotriene, because that causes bronchospasm. And C3b is the opsonin, we have discussed previously. Not a known cause of syncope. The answer is hemophilia. Atrial stenosis can cause syncope, diabetes mellitus, bouts of cough. When the person cough, so what happens? The lungs compresses. So when the lungs compresses, there is activation of vagus nerves. This causes severe vasovagal syncope. So there is another MCQ. Micturition and coughing both can cause vasovagal syncope. And testicular trauma and trauma to the chest, these can cause vasovagal syncope. True about breast, the answer is right. Arise from memory buds present on the memory line. Loss of sensation on the skin or urogenital diaphragm or urogenital triangle, the nerve is pudendal nerve. The answer is pudendal nerve. Pudendal nerve. Coming next, which of the following is not included in a dispersion? Now for the quantitative analysis of data, we are having central tendency and we are having dispersion. Now all the three options are for the central tendency. You are looking for the central tendency. For dispersion, there are other terms coming toward the reference. So this is that reference and this is USMLE. So measure of central tendency, you see. So you are having mode, median and mean. This is central tendency, and this describes the central distribution. And measure of dispersion, you are having you describe how data is distributed and include range. Other is quartiles, variance and deviation. So you look for the right answer in the exam. So out of the four option, if it is there, the range, quartile, variance and deviation, these are dispersion. So clear your mind, you will not. So the answer over here is all are not included in dispersion. These all are the parameters which measure the central tendency, not the dispersion. So there must be an option except, add except in the statement, and in the option there must be something from the variable of dispersion that we discussed. So these all are, so none of these in this MCQ, none of these. A female patient having AIDS, the answer to this is cervical cancer, because cervical cancer is linked with the AIDS. It is linked with the smoking, and it is linked with the human papilloma virus, and also it is linked with the herpes simplex virus type 2. Coming next, severe hypermagnesemia. Now we are doing a mistake. We have preoccupied our mind with the severe hypomagnesemia, and they are actually playing a little bit trick. Now if you see hypermagnesemia, the hypermagnesemia causes what? Hypocalcemia. But if the question says hypomagnesemia causes what? Now for all hormones in the body that are released, they need calcium, but for the release of PTH hormone, the body needs magnesium. So hypomagnesemia causes hypoparathyroidism, and that causes hypocalcemia. So hypomagnesemia causes hypocalcemia overall. If there is a word mild hypomagnesemia, then the answer is hypercalcemia. If there is severe hypomagnesemia, then the answer is hypocalcemia. Then the answer is hypocalcemia. So either it's a mistake over here, it's severe hypomagnesemia, or it's not a mistake and they are playing a trick. So severe hypermagnesemia can cause what? Hypocalcemia. So this is up to date, and the hypermagnesemia is associated with the hypocalcemia. So in this, nowhere it is mentioned that it causes hypercalcemia. I am talking about hypermagnesemia. So hypermagnesemia causes what? Whether moderate hypermagnesemia or severe hypermagnesemia, it causes hypocalcemia. But the mild hypomagnesemia, what causes? Hypercalcemia. And severe hypomagnesemia can cause hypocalcemia. So create your mind on this. So over here the answer is hypocalcemia. Coming next, which are the following causes hydroxyproline collagen fiber strengthenase. Now, there are two MCQ on this. That is hydroxyproline, the hydroxylation reaction that is caused by vitamin C, ascorbic acid. ADH is inhibited by alcohol. It has a diuretic effect. This is another MCQ. Alcohol has a diuretic effect because it inhibits ADH. On the right of mediastinal thoracic aorta is, now I don't know whether it is a poor recall or what does this question means. So if someone knows about the actual statement of this question, he or she can post in the comment section below. Cerebral blood flow is maintained by option A, autoregulation. Now which organ has the strongest autoregulation? Heart, brain or kidney? The answer is heart. Second is brain. Third is kidney. Reference Kenang. Local edema is caused by, answer is allergy. If there is the word inflammation, choose that, because inflammation causes local edema. If there is not, then allergy. Now the time interval between S1 and S2 is called what? This is systole. And the time interval between the S2 and S1 is called what? This is diastole. Now there is another MCQ that is coming again and again with the high controversies, that is during inspiration what happens. So the answer to that question is that volume of arterial pulse is decreased. If that is not in the option, volume of the arterial pulse is decreased. If that is not in the option, the next best option is blood pressure decreases. Well, the most common wrong answer is decrease, that is negative intrapleural pressure. The negative intrapleural pressure actually increases during inspiration. It is the pleural pressure that decreases, that becomes more negative during inspiration. Now I am giving you example for this. For example, if someone takes loan from you of 10 rupees, so that is minus 10. Now if the same person takes some other money from you, like for example 5 more, so if you add minus 5, what will be the answer? Minus 15. So the negative is increased, the negativity is increasing, but overall that is decreased. So during inspiration, if in option they mention the intrapleural pressure, what decreases during inspiration? The answer is intrapleural pressure, not the negative intrapleural pressure. If in option there is intrapleural pressure, yes, that is the right. But if in option that they have mentioned negative intrapleural pressure, then that is the wrong answer, because that is increased, the negativity is increased. The right option is actually the E, the option E usually, that is the volume of arterial pulse. Why? Because during inspiration what happens, the compliance of lungs is increased. When the compliance of lungs is increased, there is decreased cardiac output on the left side, because the blood is pooled inside the lungs. So there is decreased cardiac output on the left side, but there is increased cardiac output on the right side. So decreased cardiac output on the left side, so it means there is decreased blood coming out from the left side. If there is decreased blood coming out of the left side, so it means there is decreased blood coming to the artery, so there is decreased volume of the arterial pulse. But if that is not in the answer, in the options, then what is the best next option? That is decrease in blood pressure. During inspiration the blood pressure drops, and during inspiration the pulse pressure drops, because the systolic BP drops but the diastolic is the same. So make correction accordingly. So coming next, that is the answer to that is A, that is the right answer. The side effect of the chewing betel nut is, that is the submucosal fibrosis, and this is pre-malignant condition. Now what is the difference between the pre-malignant condition and pre-malignant lesion? Condition, you can only describe it, you cannot see that under the microscope in majority of cases. And lesion is something that condition is actually the process that causing that lesion, and lesion is actually what you can see in the microscope mainly. So there is not a big difference. But if asked about condition and lesion, well, there is another criteria, there is microscopic criteria. I am just giving you an overview of that. Condition is the process and lesion is that pathological manifestation. So that will come in the coming papers. I'm not going to waste time on that. The pre-malignant lesion, conditions, the pleomorphism, and the malignancies. With time we will explain all of these. Aldosterone is secreted in response to. Now the answer to this is increase in plasma potassium. So hyperkalemia. So what does the hyperkalemia do? Whenever there is hyperkalemia, it releases renin. Whenever there is hyperkalemia, it releases renin. The strongest stimulus for renin is hyperkalemia. The strongest stimulus for aldosterone is hypovolemia. When the volume become low. So when the plasma potassium is increased, it releases renin. That renin actually convert the angiotensinogen into the angiotensin 1. Angiotensinogen, that is plasma protein, angiotensinogen into the angiotensin 1. Then the ACE enzyme in the lungs, in the endothelium of the lung, convert the angiotensin 1 into the angiotensin 2. Then the angiotensin 2 releases aldosterone. So that is the pathway. Actually it is decrease in sodium, not increase in sodium, that causes aldosterone release. More mitochondria are present at the apex of which of the following cell? Now if the question says more mitochondria are present in which cell, the answer is skeletal muscle. But if they ask about the apex of which cell, then that is cilia. Which cell need more energy, muscle cell or the cilia cell? The answer is muscle cell. So they need more mitochondria. So if they are not talking about the apex and they are talking about only the cell, the answer is muscle. But if they are not talking about the cell, then the answer is they are talking about the apex, then cilia. True about uremic nephropathy. Now this is anemia of chronic disease. If the same question and they ask you, a patient is having uremic nephropathy and a patient is having normocytic normochromic anemia, you give only erythropoietin, and after 4 weeks the patient can have which anemia? Now the answer is microcytic hypochromic anemia. because you must give iron with erythropoietin. This is another MCQ. In CKD patient, what will you give? Only erythropoietin plus iron. So you have to give both erythropoietin plus iron, because erythropoietin is inducing the RBC to divide. So, and that need the iron for the hemoglobin formation. And there is another MCQ, which anemia of chronic disorder can be corrected? The answer is CKD, by giving erythropoietin. And there is another MCQ, that is the pathogenesis of anemia of chronic disease is, that is hepcidin, increase production of hepcidin that is produced by liver. So whenever there is a liver disorder, the hepcidin production is decreased. Actually, the hepcidin production is decreased. And what is the problem in hemochromatosis? Same answer, increase in hepcidin. The hepcidin inhibits the absorption of iron. So in anemia of chronic disease, the hepcidin is increased, so there is no absorption of iron. But in hemochromatosis, the hepcidin is actually, it is decreased. In hemochromatosis, the hepcidin is decreased. If it is decreased, so there is more absorption of iron. If there is more absorption of iron, that can cause hemochromatosis. Storage form of iron overload. Now, if they are asking about storage form of iron overload, now if there is physiological storage, then that is ferritin. If the question asks about soluble form of storage, then answer is again ferritin. If asked about the insoluble form, then hemosiderin. And if asked about the physiological storage, then ferritin. If asked about pathological storage without damaging to the organ, the answer is hemosiderin. If asked about there is storage of iron that causes damage to the cell, the answer is hemochromatosis. Three things: physiological storage, ferritin; pathological storage but not damaging the cell, hemosiderin; pathological storage and destroying the cell, hemochromatosis. So that was some MCQs regarding that. And in hemochromatosis, I discussed there is decreased hepcidin, so there is more absorption of iron, and the problem is mainly that. And which, if you in hemochromatosis, if you give decrease iron or if you give iron chelator, which two damages are reversible? Diabetes mellitus, or hypopituitarism, or cardiac abnormality, or skin abnormality? The answer is this pigmentation of the skin and cardiac abnormalities. These two are reversible. What is the most common manifestation of hemochromatosis in the heart? Restrictive cardiomyopathy. A disc is herniated, it will affect. Now the actual MCQ is, a patient is having a herniated disc, most likely it will affect which modality? The answer is sensory modality. Usually it spare the motor modality, so it affects usually the dorsal root, the posterior root. It impinges on these roots. So the answer over here is A is the right answer, the spinal nerve or the posterior root. With this, there is another MCQ that comes to my mind. Which nerve has no synapse? The answer is the spinal nerve, because these are the pseudo-unipolar neuron. So if this is neuron of the spinal nerve coming, so on the dorsal root ganglion, they form, there is condensation of cell bodies, and then the projection comes from it and enters into the spinal cord. So these are the pseudo unipolar neurons. So they are having no synapse over here. This is continuation of the same neuron. Phrenic nerve is related with pericardiophrenic artery. Pericardiophrenic artery. Which immunoglobulin in Rh incompatibility? The answer is IgG. Why? The answer is IgG because it is the only immunoglobulin that crosses placenta and causing Rh incompatibility. The most common source of transmission of HBV and HCV is through needle. For HBV, what is the most common transmission? Hepatitis B virus. The answer is perinatal, from mother to the offspring. And for HCV, that is IV drug abuser. So answer over here is B, through sharp needles. That is the right answer. With blood transfusion, if there is blood transfusion, then hepatitis B. If the question says only blood, that is hepatitis C, because blood transfusion mean you are giving the whole blood, and if only blood is mentioned, that blood mean through contaminated needles. So only blood and blood transfusion, you have to focus on that. For HCV, there is no vaccine. Why? Answer is mutation. There are a lot of mutation going on. Which of the virus goes into the chronic form without cirrhosis? The answer is hepatitis B virus. Which virus causes cancer without cirrhosis first? The answer is hepatitis B virus. Which has onco gene? The answer is hepatitis B virus, because there is and which is the DNA virus? Hepatitis B virus is actually a DNA virus, and the mechanism for it is understood as compared to the HCV virus. So there are other MCQs on these viruses as well. We will discuss with MCQ. Thirst is increased by, that is decrease in the plasma volume or increase in the plasma osmolarity. These two are the right answer. And thirst is stimulated by angiotensin 2. And angiotensin 2 blocker or the AC inhibitor that decreases the thirst. So you have to focus on the word, whether they are talking about angiotensin 2 or the angiotensin 2 blocker. Which of the following is associated with parasympathetic action? Now the answer is contraction of the pupil. Pupiloconstriction is the parasympathetic activity. Dilation is the sympathetic activity. Lesion on the nose with vasculitis. The answer is Wegener's vasculitis. Bicep related dermatome is C5, C6 is bicep, C6, C7 is tricep. So C6 is actually bicep. Heart's apex, they are talking about the heart apex, and the heart apex corresponds to the apex beat. I already discussed in my first video. Now if they are talking about the midline or the midclavicular line, so you have to keep that in mind. So that is 3 to 4 inches from the mid-sternal line. 3 to 4 inches from the mid-sternal line, or 7 to 10 centimeter from the mid-sternal line. 7 to 10 centimeter from the mid-sternal line. It cannot be more than 10. It should be kept in mind. More than 10 mean abnormal. So if you are given the option 7, 8, 9, 10, you have to pick the 10 because that is the maximum possible limit. Beyond 10, that is abnormal. Similarly, in inches, that is 3 to 4 inches. Now if they have mentioned the midclavicular line, the answer is 1 centimeter medial to the midclavicular line, that is medial, or in inches, half inch medial to the midclavicular line. So answer over here is 8 centimeter from the midline. Coming next, characteristic of carcinoma is invasion. Diagnostic of carcinoma is metastasis. Pulmonary infarction will probably lead to Now it can cause low BP, that is called massive pulmonary embolism, because whenever there is pulmonary infarction, what happens, they actually, suppose this is pulmonary trunk and these are the pulmonary arteries, if that is blocked leading to infarction, what happens, there is no blood flow to the lungs. If there is no blood flow to the lungs or decreased blood flow to the lungs, there will be decreased blood flow back to the heart. So there is decrease in the end diastolic volume of the heart. So if there is decrease in the end diastolic volume of the heart, there is less blood coming toward the left ventricle, there would be less blood leaving the left ventricle. So there is decreased BP. That's why we give thrombolytics. So actually pulmonary embolism can give rise to pulmonary infarction. So low BP. Krebs cycle is associated with acetyl CoA. Coming next, road traffic accident, BP is low, patient is in shock. What would you give? IV fluid and arrange blood if there is hemorrhage. Calcium channel blocker, beta blocker, these are the wrong answer. And what is the cause of decreased urine output? If the question asks, the answer is decrease GFR. Diagnostic of TB. Now what is the gold standard test for TB? The answer is culture. It is always culture, because it will tell you whether there is TB infection or not. It can tell you whether there are active mycobacteria or not, and they can tell you whether it is mycobacterious or mycobacterium tuberculosis or non-mycobacterium tuberculosis. So the gold standard is culture. But best initial test for TB, pulmonary TB, is chest X-ray, and the screening test for TB is Manto test. The screening test for TB in a patient with the history of BCG vaccination is IGRA test, interferon gamma release assay test. These are another MCQ that will come in the exam. So the diagnostic of TB, out of the given option, the answer is acid fast bacilli. And if asked about histologically, diagnostic of TB is, that is caseous necrosis. Smooth endoplasmic reticulum is also involved in the detoxification. Protein synthesis is caused by rough endoplasmic reticulum, because protein synthesis is caused by ribosome, and rough endoplasmic reticulum have ribosome attached to it. Which of the following is associated with carcinogen? So that is benzidine. Which mechanism is involved in carrying the particle inside the cytoplasmic membrane? The answer is panocytosis. So there are two things, phagocytosis and panocytosis. Phagocytosis means you engulf the whole organism and then degrade it. Panocytosis means you take small particles inside the cell. So there is another MCQ, if the size of the particle is more than 100, usually it is taken by panocytosis. Estrogen side effect, that is thromboembolism. There is another MCQ, long-term use of estrogen causes, the answer is hepatic adenoma. And there is another MCQ on this, that long-term estrogen can cause what? Acne. It can cause acne. Coming next, how it can cause acne? The mechanism is same, just like PCOS. Whenever there is increase in estrogen, it inhibits the FSH. So actually you are having disturbed LH to FSH ratio. So disturbed LH to FSH ratio can cause PCOS, and that indirectly can give you this thing. Which of the following is associated with left renal vein? The answer is anterior to aorta and left renal artery. Coming to our diagram. Now, as I discussed, the photographic memory lasts longer. So focus on this. This is the left renal vein. So it lies anterior to aorta, and it lies anterior to renal artery. There is another MCQ, the inferior vena cava lies toward the right of the aorta or the left? The answer is to the right. The answer is to the right. Well, there is another MCQ. The right adrenal vein or the suprarenal vein drains directly into the inferior vena cava. The left drains into left renal vein. Left renal vein. Well, there is another MCQ. Varicocele is common on the left side or the right? The answer is left side. Left side, because the left testicular vein drains into the left renal vein before it drains into the inferior vena cava, and the right drains directly into inferior vena cava. So these are the MCQs that are related with it. Now, in a normal pregnancy, hydroureter is normal on which side, right side or left side? The answer is right side, because of the orientation of the uterus and the baby developing inside the uterus, so it normally compresses. So there is expected normal hydroureter on the right side. Now there is another MCQ. You can expect edema normally in the left lower limb or the right? The answer is left. The answer is left. Why? Because the left this vein, common iliac vein, it traverses longer distance as compared toward the right. So DVT is more common on the left side as compared toward the right side. So these are some of the clinical things that are related with this diagram. So we have to look at these MCQs, and we have to memorize them as well. And there is another MCQ, that is the left renal vein. Left renal vein lies above the superior mesenteric artery or below superior mesenteric artery. You can see over here, it lies below superior mesenteric artery. Superior mesenteric artery. Coming toward physiological jaundice after the second day of birth. So it is actually after 24 hours. It is after 24 hours, and it must resolve within the first 2 weeks. After 2 weeks, if there is jaundice, this is pathological jaundice. Within the first 24 hours, if it is jaundice, this is pathological jaundice. So our head answer is A. Gallstone in a pregnant lady, investigation done. So that is gamma GGT, already repeated. Patients are informed about the disability of their child due to debilitating disease. The first reaction of the parent is denial. Like, for example, if you give them a deadly news that your son cannot walk in the future, so they cannot accept this fact. So this emotion, this feeling, this presentation is called denial. Coming next, patient is having generalized edema. The investigation of choice is serum albumin. The investigation of choice is serum albumin. Now, if a person is having edema around the eyes, generalized edema along with the periorbital edema, the problem is low albumin. Now, a patient is having edema only in the lower limbs. Most probably, a patient is having problem of heart, because they are having dyspnea and they keep their head end elevated. If they keep their head end elevated, so there is no edema on the face. So over here the answer is urinary proteins, but you have to look for the serum albumin. The most serious side effect of gas gangrene is toxemia. Fast pain is carried by A delta fiber. Pretracheal infection will transfer to anterior mediastinum. Pretracheal infection will transfer to anterior mediastinum. Now we are having two mediastinum, superior and inferior. The inferior is then divided into anterior, middle and posterior. So if there is a pretracheal infection, that will spread into the anterior mediastinum. Which of the following is associated with adrenalectomy? So sodium chloride gives salts because adrenals is having aldosterone. If you remove that, then patient is having hyponatremia. Which of the following is associated with active transport? The answer is energy. True about CD4 cell is they are the helper T cells, and the CD8R we discussed, they are the cytotoxic T cell. In severe diarrhea, metabolic acidosis with the normal anion gap. In chronic diarrhea, there is metabolic alkalosis as a compensation. So coming next, spinal anesthesia is given to a patient. There is sudden loss of, actually there is a shock. The original term is there is shock. The answer is loss of motor tone. They are talking about the spinal shock. But even if they are talking about sensation, initially it is due to decreased blood flow. Then later on that is because of anesthesia effect, sodium channel blockage. But the original word over here is shock. That is loss of vasomotor tone. Radiation is given to the patient depends upon duration for which radiation is given. Definition of vital capacity, that is tidal volume plus inspiratory reserve volume plus expiratory reserve volume. Well, there is another MCQ that is coming to my mind. A patient inhales maximally and then exhale. Now this is actually a poor recall. When a person inhales maximally and he exhales either normally or maximally. So if a person inhales maximally and then exhale normally, this is inspiratory capacity, because maximum inhalation and then followed by normal exhalation. So it includes the inspiratory reserve volume and tidal volume. So it is inspiratory capacity. Now the same question, if we modify a little bit, a person inhales maximally and then exhale maximally. So if he is exhaling maximally, so you include another thing, there is expiratory reserve volume. So it is actually inspiratory reserve volume, the tidal volume and the expiratory reserve volume. That is actually then the vital capacity. That is actually then the vital capacity. What is the effect of pregnancy and respiratory rate? The answer is constant. What is the effect of pregnancy on tidal volume? The answer is increases. What is the effect of pregnancy on minute ventilation? The answer is increases, because minute ventilation is equal to respiratory rate into tidal volume. If tidal volume is increased, the minute ventilation will increase. What is the effect on vital capacity? The answer is constant or mildly increased. So that is not decreased. So what is the effect of pregnancy on the residual volume? The answer is decreases because of the effect of the baby. Metabolism of drug is increased by, now this is again poor recall, this is actually P450 enzyme induction. The P450 enzyme induction increases metabolism of drug, and the P450 inhibition decreases metabolism of drug. So in given option I will pick the option B, because if you are increasing the liver enzyme, that will increase the P450 inhibition, but in excitation. But the enzyme inducer, if you are increasing the liver inducer enzyme, not inhibition. If you are increasing the liver enzyme that are inhibitory, that will decrease metabolism. Which of the following is associated with amniotic membrane? The answer is it is non-immunogenic, and the reason for this is we use it for corneal transplantation, because that is 100% non-immunogenic. Non-immunogenic means the body is not recognizing it as a foreign body and does not produce antibodies against it. Which of the following is associated with Broca's area? Already discussed in my first video, middle cerebral artery. Interior branches or posterior branches of middle cerebral artery? The answer is interior branches. And Wernicke's interior branches or posterior branches? The answer is posterior branches of middle cerebral artery. Optic chiasma causes bitemporal hemianopia. Now over here I will suggest that if they are asking about the visual fields, that is actually the bitemporal hemianopia. But if they are asking about the nerves, so that is the nasal side. The nasal side. If they are asking about what will be the consequence, the answer is absolutely right, bitemporal hemianopia. But if they ask which side of the retina is affected, the answer is medial side. Or if they are asking about which nerve fibers are affected, that are the fibers on the nasal side, because the nasal side pick the temporal side, and the temporal side pick the nasal side. In infection of the brain, what necrosis occurs in the brain? There is liquefactive necrosis. Fibrinoid necrosis is actually type 3 hypersensitivity reaction. Usually there is an antigen antibody reaction, and they deposited in the vessel, in the arteries, seen in vasculitis mostly. Golgi tendon organ is involved in relaxation. Right answer, already discussed previously. Insulin is increased by glucagon-like peptide 1 or gastric glucagon-like peptide 1. Now this is from the Genang book reference. Strongest stimulus for insulin is glucagon-like peptide 1. And there is another MCQ, that is if you give glucose orally or IV, which will increases insulin maximally? The answer is oral, because when you give orally, that is actually glucagon-like peptide 1 that releases the insulin. If you give the IV, the glucagon-like peptide 1 is not released, so it cannot release the insulin. Posterior communicating artery. Posterior communicating artery, it connects. Posterior communicating artery connects. So the answer is ICA with PCA above the oculomotor nerve. So internal carotid artery is the posterior cerebral artery, but above the oculomotor nerve. The right answer is missing. So the posterior communicating artery, it is a branch of internal carotid artery, so it communicates with the posterior cerebral artery, but above the oculomotor nerve. Bioavailability is increased by IV. Basal ganglia is involved in initiation of movement. Basal ganglia. Macula densa secrete renin. Now if there is a single N and kidney is having single N, so single N kidney, but if the renin is having double N or double NIN, then this is in the stomach, that causing curdling of the milk in the infants. Female hormones are derived from which of the following vitamins? Poor recall, don't know what are they asking about. Hypokalemia in ECG is represented by U wave. Regarding CSF finding, decreased glucose in pyogenic, yes. In bacterial meningitis, glucose is decreased. Bar body is diagnostic for. Now the presence of bar body is diagnostic for, there is a single bar body, then the answer is Klinefelter, because XXY, you are having an extra chromosome. The person is male, so there is no bar body supposed to be, because male is having XY only, and there is no bar body in male. There is only bar body in female, but in male if there is bar body, then this is Klinefelter syndrome. The absence of bar body is diagnostic for, that is called the Turner syndrome. In the Turner, the patient is female, and in female there is one bar body. If you do this test and there is no bar body, so this is Turner. In male there is no bar body, and if there is bar body in male, this is Klinefelter syndrome. Coming next. Now this is very important. A farmer working in a farm for many hours on a hot day and suddenly feels unconscious due to increased sweating. This is called heat exhaustion. Heat exhaustion, increased sweating, heat exhaustion. Now if the same question and they ask the patient is having a fever of 106, then the answer is stroke, heat stroke. Heat stroke. The main difference between heat stroke and heat exhaustion is, in heat stroke there is high temperature and no sweating. In heat exhaustion there is sweating and there is then decreased temperature, but there is profuse sweating that leads to a dehydration. So focus on these two things. If there is a high temperature, then it is heat stroke, then this is not increased sweating. In heat stroke there is decreased sweating. And if they have not mentioned the temperature, they have mentioned the temperature is 100 or 101, then this is not heat stroke, then this is heat exhaustion and the patient faints. Now if the same MCQ and they have given you the sodium of 120, the answer is not dehydration, not sweating, because sweating causes hypernatremia, dehydration causes hypernatremia. It is what it is, compulsive water intake, IV fluid overload. So a patient was having heat exhaustion initially, but he took so much water thinking of dehydration as a possibility that leads to further hyponatremia. A patient is having sweating that causes hypernatremia. A patient is having sweating followed by only water intake that causes hyponatremia. Regarding end arteries, mostly present in vital organs such as the eye, brain, heart, and the kidneys. Female in labor, station 2 on PV, E-shaped spines inverted, arch, less triangular. Which type of pelvis is this? This is actually in right pelvis. Option C is the right answer over here. Patient in operating room suddenly develops decrease in respiratory rate. Now patient is having bradycardia, heart rate dropped to 20. The initial step is give IV atropine. Gives the IV atropine. Simple squamous epithelium present in all except ureter, because ureter is having transitional epithelium. Blood leaving placenta has how much percentage of PO2? This is not percentage actually. These are the given in mm. This is actually mm, and that is 30 mm. So blood leaving placenta, that is actually talking about umbilical artery. They are talking about umbilical artery, because umbilical artery leaves the placenta in baby and carries oxygen to the baby, and that is having 30 mm of oxygen, and the saturation is 80%. Saturation is 80%, and oxygen tension is 30 mm, and oxygen tension is 30 mm. Coming next, the answer is human menopausal gonadotropin followed by HCG, because it has both HMG, FSH and LH, then followed by HCG. So you are actually maintaining a normal circadian feature as far as the female these hormones are concerned. Oral buccopharyngeal membrane separates. Now the correct option over here is buccopharyngeal membrane from the primitive gut, option C. 50 years old male, strenuous work, heart surgery, blood sodium is 110 to 120. Now you see the answer over here is compulsive water intake. Coming next, which drug does not cause tetrogenicity, SSRIs? Invasion of the following more mitochondria present in the apical. Now if they have mentioned the word apical, so the answer is cilia. If you remove the apical, the answer is skeletal muscle. So here D is the right answer. In chronic intravascular hemolysis, the answer is hemoglobinuria. Hemoglobinuria. In acute, decreased haptoglobin. Or if there is no mentioning of chronic, then decreased haptoglobin. Limb drainage of anus, medial groove of superficial inguinal lymph nodes. Coefficient of variance include all except Now we discussed previously coefficient of variance. Well, they are talking about the dispersion. The dispersion is actually the range over here. All other three are actually central tendency. So the coefficient of variance over here mean the not the central tendency, but the dispersion, and over here the only dispersion is range. So poor recall, severe bradycardia and low pulse oculocardiac reflex is stimulated. So this is what this causes vasovagal syncope. So stop the stimulus. So the other half will be uploaded tomorrow. Thanks for watching.